What is Huntington's disease? Have you ever wondered about Huntington's disease and how it impacts individuals and families? Huntington's disease is a progressive, inherited brain disorder that leads to the gradual breakdown of nerve cells in specific areas of the brain. This condition is caused by a single defective gene located on chromosome 4, which is passed down from parent to child. If someone inherits this gene, they will eventually develop the disease, as it is a dominant genetic condition. The disease primarily affects regions of the brain that control movement, thinking, and mood. As Huntington's disease progresses, individuals experience a variety of symptoms that worsen over time. The most recognizable symptom is chorea, which refers to involuntary, dance-like movements of the arms, legs, face, and upper body. These movements can become more noticeable when a person is nervous or distracted. As the disease advances, some individuals may also develop rigidity or stiffness, leading to a condition known as akinesia, where movement becomes very limited. In addition to movement challenges, Huntington's disease can cause cognitive decline. This affects memory, concentration, judgment, and the ability to plan and organize tasks. Mood changes are also common, with individuals experiencing depression, anxiety, irritability, and sometimes obsessive-compulsive behaviors. Symptoms typically appear between the ages of 30 and 50, but they can start earlier or later in life. Currently, there is no cure for Huntington's disease. Treatment focuses on managing symptoms and improving the quality of life for those affected. Supportive care, which includes physical, occupational, and speech therapy, can help individuals maintain their independence for as long as possible. Medications may also be prescribed to help control movement problems and mood symptoms. It is essential to understand that while both Huntington's disease and Parkinson's disease are movement disorders, they have different causes, symptoms, and progression patterns. Parkinson's disease is also a progressive neurological disorder, but it is not inherited in the same way as Huntington's disease. Parkinson's primarily affects movement through symptoms like tremors, stiffness, and slowness of movement, caused by the loss of dopamine-producing cells in the brain. Unlike Huntington's disease, Parkinson's does not typically lead to involuntary dance-like movements or follow the same genetic inheritance pattern. For caregivers and families, recognizing the differences between these disorders is crucial. It helps in identifying symptoms, seeking appropriate medical care, and providing the right support. Both conditions requiring ongoing management and a team approach to care, which includes medical professionals, therapists, and support groups. Caregivers should be aware of the unique challenges each disease presents and seek education and resources tailored to the specific needs of their loved ones. In summary, Huntington's disease is a genetic, progressive brain disorder that leads to movement problems, cognitive decline, and mood changes. While it is distinct from Parkinson's disease, both conditions requiring comprehensive care and support for affected individuals and their families. Caregivers are encouraged to consult healthcare professionals for personalized advice and guidance.